Dr. Vince Duenas of FHP and Takecare Insurance says healthcare facilities designated as Tier 2 clinics have had to lawyer up to see if they'll even be reimbursed for their services after the governor activated SDA, FHP, and American Medical Center as part of her COVID-19 response with her Executive Order 2020-06. Despite the order's clear language designating Tier 2s in emails KUAM obtained by Freedom of Information Act request, Governor's legal counsel, Hai Hyun, wrote both FHP lawyer Louis Yanza and AMC counsel Jackie Terlahi saying, quote, "We have not received any indication that any medical facilities, supplies, or providers have been directed to act as government entities," end quote. This statement totally contradicting what the legal counsel's client said at a March 24th press conference.
Tier 2 will be for non-COVID-19 urgent care facilities. I have designated the American Medical Center, FHP, and SDA to be used for urgent care. Tier 1 will be all other healthcare facilities and providers. As a condition of their licensure, all healthcare facilities and healthcare providers on Guam will be required to assist in the vaccination, treatment, examination, or testing of any individual who, on instruction from the Department of Public Health and Social Services, presents himself to any clinic or other healthcare facility for medical assistance.
And despite leading the procurement and payment of GovGuam quarantine hotels and associated vendors without contracts, Hyun changed his tune to Tier 2s, writing formal direction, quote, would have been in the form of a contract for procurement purposes. As you know, procurement law does not allow for payment of services prior to the execution of an agreement, end quote. And while Dr. Duenas says FHP answered the governor's call to serve, the clinic is struggling because there's no word on when it'll be reimbursed for the COVID costs it incurred.
We have had to make very difficult decisions as an organization. Everything from pay cuts to reduced hours to even furloughs, unfortunately.
We asked Duenas if FHP has had to let go of any doctors.
Not yet, but I can say that a few physicians have been given notice.
Now, when KUAM asked the governor why Tier 2s haven't been paid yet, she said it was because she hasn't gotten any invoices from them. But what's interesting to note is that the governor hasn't seen an invoice from the clinics because her own executive order says the Cure Action Team, led by State Surgeon Dr. Mike Cruz, is responsible for developing a system for Tier 2s to be reimbursed or billed at a rate set forth in Memorandum of Understanding or such other standardized uniform rate as developed by the Cure Action Team. And according to everyone we asked, the Cure team hasn't done a MOU. Meaning there's no way for the clinics to send invoices because a reimbursement plan hasn't been completed. On April 22, Hyun wrote to Attorney Terlahi saying, quote, to this date, no SOPs have been developed and no facilities, providers, nor supplies have been directed for government use, end quote. At the time Hyun wrote this, the governor's order designating Tier 2s had been in place for a month. $7 million for Tier 2 clinics was included in a CARES Act budget proposal prepped by BBMR, and Duenas said that could be an easier way for Tier 2s to get relief.
Now, if you have clinics saying that we took huge losses just from COVID alone, I think the focus should be more on stimulus funding to help support those clinics in order to strengthen the healthcare system as a whole.
And while clinics say they haven't been reimbursed, it's not for lack of trying. Attorney Yanza sent a summary of FHP's expenses from March 17 to April 25, 2020. That summary, $955,562. Emails also show Attorney Mitch Thompson, representing SDA, has also tried to follow up on compensation. Duenas had also written to the governor's office about using CARES funds to compensate clinics or at least provide aid to them. Duenas writing Adelup staffer Shamra Chargaloff on May 1st, asking if Chargaloff knew whether or not Tier 2s would be getting, quote, direct financial relief related to COVID. Chargaloff sent that email to former Chief of Staff Tony Babauta and Hyun. On that same day, Hyun wrote to Chargaloff saying, quote, I do not know who this doctor is, but the answer is that there has been no arrangements with any clinics. Nothing formal has occurred, end quote.
The bottom line is that clinics are hurting, and we're asking for support, and I think CARES Act funding allows us to get that sort of relief.
For Guam's News Network, Chris Barnett reports.